Catheter exchange and indeflator use. First, gather all your materials. Most diagnostic procedures require a JR4 for the right coronary artery, a JL4 for the left coronary artery, and a pigtail for the ventriculogram. Make sure you have a saline to flush each catheter, a .035 inch, 150 centimeter J-tipped wire, and your normal saline or heparinized saline solution. Flush each catheter until 1 to 2 milliliters of saline come out the distal end. If this is your initial catheter insertion, you may backload the catheter with the wire. Go ahead and insert the floppy J-tipped wire into the proximal hub of the catheter and advance it until a little bit of the wire comes out of the tip, and then pull back slightly. Once the physician inserts the catheter into the sheath, advance the wire slowly. If you feel any resistance, stop. Advance the wire until the wire sits in the aortic cusp. Upon removal, use a 4x4 to wipe the wire and use it in a looping motion and twisting the back 1 to 2 times to keep it stable on your field. Once the pictures have been taken, the doctor will remove the catheter over the wire. The doctor will hold the sheath, and you will use a pin and pull method to remove the catheter over the wire. You want to use 1-inch bites to slowly pin the wire and pull the catheter back. And make sure you're assessing the monitor to see your wire position in the aorta. Once the doctor has the wire pinned, you can remove the catheter off the end of the wire. Place the catheter securely on your table. Take your next catheter and insert the end of the wire into the proximal end of the catheter. Advance the wire until you see the wire come out the distal end. Pull the wire in a rail fashion and advance to the physician, making sure not to move the wire. Voice to the physician that you do have the wire pinned. And always verify on fluoro your wire position. Indeflator use, gather your equipment. You will need an indeflator, contrast solution. We usually use Omnipaque, Visipaque, saline. Place the end of the indeflator tubing in the contrast solution and saline and draw negative to obtain your desired ratio mixture. Remove all air out of the indeflator by placing it upside down and either twisting the handle or pushing up the handle to purge the air. You might come across different types of indeflators, but most of the prep is usually the same. Connect the indeflator to the balloon port. In a rail system, which is shown here, there is only one hub in which the indeflator can be connected. For over-the-wire balloons, the indeflator is connected to the side port. Connect the indeflator to the correct connection. If you're using a balloon, you can pull negative at this point to reduce the profile of the balloon. If you're using a balloon expandable stent, do not pull negative, as it can cause the stent to remove from the balloon placement. Once placement is confirmed, the physician will ask you to inflate the balloon. First, activate your timer, then voice you are going up on the balloon and watch the monitor closely. If you have a stent, at this point you will pull negative, and then for either one, release the negative pressure. You turn the handle to the atmosphere pressure stated by the physician. Usually you will go up to nominal pressure stated in the device. The nominal pressure is the atmosphere in which the balloon will reach its stated diameter. The burst pressure is the pressure in which 5% of balloons will burst. If you have a scoring balloon, you must go up slowly to nominal at about 2 seconds per atmosphere, as well as come down slowly for nominal. While going up on a balloon inflation, always check placement, your waveform, atmosphere on the indeflator, heart rate, and blood pressure. When the physician is ready, he will ask you to come down. Release the pressure first by turning the handle a few times, then pull negative to decompress the balloon. Once the balloon or stent is out of the catheter, disconnect the indeflator, remove all air, and leave it ready for the next inflation. Money, 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 money.